Well, there's a man who knows what he thinks, the chef and campaigner, Jamie Oliver. And I just happen to have the Health Secretary, Jeremy Hunt, with me. Welcome, Mr. Hunt.
Good morning, Andrew.
Now, let's move to the junior doctors' strike. There is a central sort of poisonous misrepresentation, which I think has made this a particularly bitter dispute, which is your assertion that the 11,000 extra deaths at the weekend are connected with poor staffing by junior doctors in hospitals. That drives them absolutely insensate with anger, and it's not true.
Well, the truth is that junior doctors are right to say that as we deal with the higher mortality rates at weekends, it isn't just about junior doctors. It's about being able to get diagnostic tests back at weekends. It's about consultant cover.
Yeah.
But if you look at, we've had, I think, now 8 studies in the last 5 years, and they all say that staffing levels at weekends are one of the issues that needs to be seriously...
One of the issues, but not... And Sir Bruce Keogh, who did the report, has said that it would be rash and misleading to suggest that these deaths are avoidable by changing staffing.
He actually said that it would be rash and misleading to say that you could avoid every single one of those deaths. But he is also very clear that staffing levels matter. And I think one of the unfortunate misunderstandings, junior doctors work incredibly hard. They are some of the hardest working people who do some of the most weekends and nights. And we need to support them to do their job better. I think when we deliver a 7-day NHS, and this in the end is about making the NHS the safest, the most high-quality system in the world. The first thing I had to deal with as Health Secretary was the tragedy of mid-staffs. And I've learned from that when you have these studies that say you've got these problems, you can't duck them. You have to deal with them.
But, I mean, you have connected those excessive deaths to the whole question of rostering and junior doctors. And that is what people think is misleading, because it's a much more complicated situation than that. Many of those deaths are caused by the fact that people who go into hospital at the weekends are already iller and therefore much more likely to die. And Sir Bruce Keogh and many others have said you can't connect the number of deaths to rostering questions, and yet you have.
Well, that's not true. If you look at those studies, let me just tell you, if you look at the studies, and we've had studies that came out by Fremantle last September, we had the study that came out by Professor Aylin just before Christmas. They all say, the Royal Colleges say, that you have got to look at staffing levels. We have 3 times less medical cover at weekends. Now, we're never going to have the same levels because there are going to be lots of things, and I think this is another misunderstanding, I mean, lots of things that we don't do at weekends, hip operations, knee operations and so on, but for urgent and emergency care. If I give you one example, which actually relates to senior doctor presence, the clinical standards, and this is all about making sure we meet the clinical standards. They say that if you're admitted to hospital, you should be seen by a senior doctor within 14 hours. That currently only happens in 1 in 8 of our hospitals. Now, if we want to promise, if we want that happens across 7 days a week, if we want to promise every NHS patient, as I do, that they're going to get the same high-quality care every day of the week, then we have to look at these issues.
I definitely want to return to that, but just to stay on this central question of misrepresenting the position of junior doctors, I can quote to you 2 things you've said. There are 11,000 excess deaths because we do not staff our hospitals properly at weekends, and you've said that excessive overtime rates give hospitals a disincentive to roster as many doctors as they need at weekends, and that leads to 11,000 excessive deaths. Against Sir Bruce Keogh, who did the research, who says it is not possible to ascertain the extent to which of these 11,000 deaths may be preventable. To assume they are avoidable would be rash and misleading. So when the editor of the BMJ accuses you of misrepresenting that report, she was right.
She was wrong. And if you look at what Bruce Keogh said there, he didn't say that what I said was wrong. He said it's wrong to say that you could avoid every single one of those deaths. But he also confirms that that staffing levels are one of the issues that need to be investigated amongst many other issues. And look, in the end, it's intuitively a very sensible thing to observe that if you don't have enough senior doctors when people are admitted to hospital at weekends, if you're not able to check, for example, the most vulnerable patients twice a day, which is what the clinical standards say, then your risk of a death that could be avoided is higher. And so I came into this job wanting to make sure that we offer the highest standards of care for every single patient. And I think the sad thing about this is that, you know, we're going to have a strike on Wednesday. And actually what I want to do is what every single doctor wants to do. They want to give the highest standard of care to their patients. And what we should be doing is sitting around the table discussing how to do this, rather than withdrawing care from patients, which can only harm them.
You have said again and again the phrase senior doctors. Why go into head-to-head confrontation with the junior doctors, who are the very people who are actually staffing hospitals at the weekends and, you know, who are not responsible for 11,000? Can we agree that they are not responsible for 11,000 deaths in hospitals over the weekends?
I think there are a number of things that are leading to these. There are a number of things. If you look at the study, I think, you know, you're saying to me that we need to be very careful with our words. And if you look at the studies, they all say there are a number of factors that need to be investigated, including staffing. But if you just look at this contract, and I think there have been a lot of misunderstandings, but look at the crucial issue of pay, because I think this is something that worries people. We are being absolutely clear that we don't want to cut junior doctors' pay. In fact, for the majority of them, it will go up.
Well, you look at the... sorry, just on pay, you said something that I don't understand at all. You have said that this is revenue neutral. You've used that phrase. It's not going to cost any money at all. And you've said that 75% of junior doctors are going to be paid better, have more money coming in, and the rest won't be worse off. That is mathematically impossible.
Well, in the short term, as we transition to the new contract, it will actually cost us more as we protect the pay of people as we move to the new contract. But when we move through to the new contract in 4 years' time, the total amount going into the junior doctors' pay packet will be higher, not lower.
So it's not revenue neutral.
So, it will actually, you know, in the end, if you're going to ask more doctors to work at weekends,
you're going to have to pay more money.
You're going to have to pay more. But in order to be able to afford that, to do that in a way that's affordable for the NHS, we do need to reduce, this is a very important point, we need to reduce the premiums that we pay at weekends, make up for it with an increase in base pay. But even after these changes that we're making, junior doctors will get a higher premium for working at weekends than the nurses working in the same hospital, than the ambulance drivers who take people to the hospital, than the porters, than the cleaners. It's a good deal for junior doctors, but most importantly, it will make care safer for patients, because what we need to do is to make sure that our hospitals are properly staffed at weekends.
If it's such a good deal, why do you have to protect their pay for 3 years?